Well, hello. It's great to have you with me today. I'm speaking with Dr. Chelsey Deel, who's one of my colleagues here at the University of Oklahoma and actually a former mentee. We worked together when she was a resident, and I'm really happy to have the chance to talk with you in greater detail, Chelsey. So tell us a little bit about yourself and your background and how you came into pathology.
Sure, absolutely. Well, thank you so much for having me, and I'm really excited to get to talk to everybody about pathology. So like you said, I'm Chelsey Deel. I'm an assistant professor here at OU. My story, just in terms of I'm a Texas native, so I did not move far, but went to undergrad and medical school in Texas, and then went to residency here at OU. Left briefly for a fellowship in hematopathology at Tricor Reference Lab in Albuquerque, New Mexico. And then I came back in last year, 2019, as an attending. So didn't move far. Again, Oklahoma is great because it's close to my family. I have a lot of family members in the area now. But that's sort of my school story. But how I came to choose pathology, I think, is always an interesting question, because I had a lot of classmates who really were kind of concerned that I was choosing pathology. I seemed very personable. I seemed very, I like talking to people, which is kind of getting at some of the stereotypes you'll hear about pathologists, which I have discovered not to be true. But I think for me, and it's also kind of interesting because I actually remember saying before I started medical school, I said, the one thing I don't want to do is look at microscopes. And that's actually what I do for a living now. And I think I had this idea of, microscopes just in the research arena. But when I got to, medical school, I really didn't know what I wanted to do at all. My dad was a physician, a surgeon, but, he had this idea of surgery for me, but that definitely did not pan out. But I really kind of came into it with an open mind. And I think second year, we had a forensic pathologist come talk about her autopsy experience. And I immediately came down to her at the end of the lecture and said, how can I shadow you? How can I see more? It was so interesting to me. And so I actually went and got to see a couple of medical examiner autopsies, even as a second year student. But again, that was really the only exposure I had. I had no idea about what a pathologist actually did day to day. I just knew the pathology of the class. So there was some free time in third year to do a rotation. And I actually did a surgical pathology rotation. I didn't even know what that meant, surgical path, but it was available, so I did it. And I just had the sense as soon as I walked in that these were my people. I don't know how to explain it. It was just, they had such a fascination for, learning the pathophysiology of things, learning how things worked. There was that intellectual curiosity, and they really loved putting the whole story together. How does the patient's clinical findings fit with what we're seeing under the microscope? And I just found it such an investigational challenge. And I just was like, this is so interesting. Why do people not know more about this? And as I rotated more, it just became a huge fit for me, because I really liked that kind of behind the scenes aspect. I love that you really were contributing to the patient's care, and you really were a huge part of what happens to them in their treatment. So from then I was just hooked, and kind of the story was written then. My second consideration was possibly pediatrics, but again, it was nothing approached the passion that I had for pathology, because I just thought it was cool. I mean, you get to see these huge tumors come down on a bench in front of you, and you get to work it up and figure out what it is, and it just felt like such a cool investigational challenge. So I really am passionate about students rotating through, because I think I would not have known otherwise what pathology actually did. And it's actually interesting. My dad's a surgeon, and he works with path a lot. And he said, oh yeah. So he really understood why I wanted to do it, because he always thought it was interesting.
I think your experience is very typical, that many students start out without any sort of sense of what pathology is or what they do, and what the challenges and opportunities are and how those sorts of things could be really fulfilling to you. So tell me about what your day is like now. What kind of people do you deal with? What kind of problems are you facing in your day-to-day work now that continues to provide that kind of fulfillment for you?
Sure, and based on that, I can kind of share my screen, and we can kind of use a couple of the pictures I have as a jumping off point. So can you see that?
Yeah.
Okay, so those are actually very good questions, because I actually want to start with this, who I work with, because kind of getting to the stereotype of, a pathologist doesn't like people, they hide in their offices like hermits, is really not true at all. I actually find that I pretty much talk all day. It just depends on who you're talking to. So, the list really grows. I could probably add to this list, but we're kind of known as the doctor's doctor. You end up talking to other providers a lot about their specimens and results and things like that. But I want to point out, we actually have in the laboratory, it's a huge space, and there's a lot of lab staff. And one of the challenges, at least on the on the CP side, clinical pathology side, is I'm the laboratory or the medical director of several sections of the lab, and that comes with its own unique opportunities and challenges. But to that end, you're actually talking to a lot of lab staff all day. They're bringing you issues. They're bringing you, any other concerns. They actually bring you exciting cases that they see. So I find that I'm pretty much talking constantly. And then I'm also talking to residents and medical students. I mean, you're anybody who's rotating with us. So I really, you're not really alone in your office. You talk to, and you have to have that level of communication to tell people results, to communicate what other tests would be helpful. So that stereotype really I discovered not to be true. But I work with a lot of different people. And as far as where I work, you can't go without showing some cool pictures of OU and Dr. Hassel. We of course are colleagues, and so I like this picture because it shows, this is the adult hospital. Actually, can you see my cursor, Dr. Hassel?
Yes.
Okay.
Yes.
So, this is the adult hospital. I like this picture because it shows the new patient adult tower that's gone in, that's going to add to our volume. And I love it shows actually the Capitol. So it kind of shows you how close we are to the Capitol building. This is the beautiful, Children's Hospital where I'm based. I'm actually in the basement of the Children's Hospital here. And then here is our beautiful cancer center. I work a lot with the folks there because my focus is hematopathology, is leukemia, lymphoma, myeloma. And so I work a lot with the oncologist over there to talk about the patients and what the next steps are. So you get to work in some pretty beautiful places. And like I said, there's a lot of communication that happens pretty much all day.
Yeah, if a pathologist can't communicate effectively, they're pretty much handcuffed. And you're right. I don't think we hide behind a curtain or in a closed, hermited type office. I think very much you're more like the phone operator, where all the calls go through you. And as you say, all the interesting cases eventually cross the pathologist's desk. And I think that's one of the most fascinating things about our practice is that the good stuff in medicine really does come to your attention in one way or another. So you get to share in that excitement with your colleagues, but also you have very often that final word of finally resolving and putting it all together and making all the connections that need to be made.
And I think that's what I want people to realize about pathology is that, like you said, you're often that final word to determine what treatment there is. There's usually, based on the clinical findings, there's usually a differential, but you often provide that last say of, this is leukemia. And I say that to say because there's definitely a responsibility that comes with it, so it's not, I don't take that lightly, but it becomes very exciting because you say, this patient has leukemia and it makes you feel good that they're getting the right treatment. They're getting the care that they need. So you realize how much you are a part of the clinical care. I don't see a patient directly most of the time, but again, you're a huge part of what happens to them from then on. Giving somebody the diagnosis of leukemia is life-changing. So, it's something, like I said, that I don't take lightly, but it becomes very exciting and very rewarding And so that kind of, comes to some of the, like I put this slide about challenges and problems that I solve. I think one of them is definitely the diagnostic part of it. This is just showing on the left, a peripheral blood smear, just to show what I deal with on a day-to-day basis is to do with blood and bone marrow. And this is just a picture I showed to the medical students in the past that showed an acute myeloid leukemia. And so, that's something that I have, become trained in, and it's just a really exciting field. And I feel like every day there's new challenges and new problems. But the other thing that's really nice that I talked to my husband about is every day there's something new, which is exciting. There's always a new case. There's always a new problem to solve. And there's lots of things that don't read the textbook. And so it becomes a really exciting thing to figure out the case and try to put it all together. So it's a challenge, but it's also really, really exciting when you can figure it out.
Yeah, a lot of pathologists have come, at least or candidates that I've talked to have talked about how much they enjoy solving puzzles, whether it's crosswords or Sudokus or other kinds of intellectual gymnastic type of puzzles, and that really is our work day to day, is solving those kinds of problems and developing answers, and also understanding where the limitations are, because you're right, the variations on the theme and the nuances of disease that have yet to be refined are always with us, and usually those show up in our practice day to day.
And I'm never, I never feel bored. I mean, there's never like, oh man, it's just, here's another day of, because it's always something different. Yes, I mean, I do specialize in sort of leukemia and lymphoma, but like you said, there's huge variation in presentation. Even within leukemia, it's so complicated. I feel like the moment a journal comes out, it's already out of date. There's always new information coming out. So it's a challenge. And I think the other part of it that people don't always realize about pathologists, so I showed a couple pictures from our lab. The other challenge is being a laboratory or medical director. I had never done anything like that prior. And so there's its own unique challenges of running a laboratory. On the left is our analyzer that does our CBCs. So that's my sort of machine I deal with a lot. And on the right, I show a lot of the rest of our lab to show that we're actually undergoing a lot of new machinery, renovation, and with that comes its own challenges that I never knew about before. So it's actually really interesting. There's a lot of management that happens. There's a lot of other skills that I think I didn't learn in med school and was never prepared for until I became part of the lab and realized it's a whole world down there that, physicians send their samples down and they get an answer back in their computer and they don't know what happens in between. And there's really a lot of work in between. There's a lot of people that work down there. There's a lot of machinery. I mean, you can have flooding that happens down there that can shut stuff down. You just don't think about these things. It's sort of this black box, as people say. But that's what I found really cool, because I get to be a part of it, and I watch and I can see these automation and I can see how things work. And if you're a person that wants to see how something works and get down to that, you're definitely kind of a budding pathologist.
Well, yeah, and I think that's an interesting skill set too, because a lot of the skills that maybe are applied in business or in manufacturing or in human relations, all of those problem-solving skills in those domains also have to be part of what a pathologist does in many circumstances. And so you're right. You ought to get an MBA along with your MD, along with industrial design and management training to be able to really function at a high level in pathology. So it's very stimulating, very challenging, and very diverse. And obviously you've illustrated that here. So where's the real fulfillment? I mean, you've talked about this already, but what are the things that give you that aha? What do you really feel about when you talk to your husband and tell him the great things that happened?
Well, that's a great question, and I found he's sort of a kindred spirit, and I'll show a picture of him later. So my husband is also a physician. He's actually a pediatrician, And so that, there's definitely a lot of, base understanding of, medicine and things like that. But I laugh because he used to think that, we used to like slap the tissue on the slide and then you look at it. Like that's how it works. No knowledge of what's in between. And so it's been, what I find the aha moment for me is talking about our career and talking about what we do to a student or to a resident or to somebody in my family. Because a lot of times family members have heard of a pediatrician, they've never heard of a pathologist. Even though a pathologist has been involved in their care, probably, it's just they don't know who they are. And so I find the aha moment is when a medical student rotates with us and they're like, oh my gosh, oh, that's what leukemia looks like. Or, oh my gosh, that's so cool. Those are such worthwhile moments for me, is getting to see that smile, like, wow, I didn't know that's how it works. And oftentimes when I take them through the lab, and that's why I show these pictures, their eyes kind of get wide because they just didn't know how much of an enterprise this was. I like, just to get a CBC or just to get a metabolic panel, I mean, they had no idea this is what the lab looked like. So those are real aha moments for me. The other aha moments, there are sometimes that I've gotten a case where they were suspecting something and I was able to tell them, no, this is completely different than you thought. This is actually myeloma. And they kind of go, really? So you get to be like, wow, I was very helpful in this case because, this could have sent them down the wrong path. And this is, again, sort of changing the trajectory. So I really felt like that's when you feel good. You're like, okay, this is, I feel like I was trained well. I'm doing my job. I'm doing my job well. So those are the aha moments, I think, for me, where it just makes you smile and you're like, man, it really was just a fun day.
Yeah. Yeah. And those moments, you don't really need a thank you from your patient or a hug from your patient, because you sort of get that from the physicians you're working with, when they go, oh, okay, well, good, we're going to go this direction because of that choice and that outcome. And that's just as rewarding.
Mm-hmm. And I think, and for some people who, I know that the fact that pathologists don't, typically see patients can be a deterrent. One thing I would say is that there are certain specialties within pathology that do see patients regularly. Cytopathology and transfusion are some. But I also want to say that I think a trend in some of the bigger academic centers, it seems, is that pathologists are starting to have times with patients to talk about their results. That seems to happen more and more. And so you can definitely, if you go to an institution, be that pathologist who has some face time with the patients to explain their reports. So it's definitely still possible. It's definitely still out there.
Yeah. So fill in some of the rest of the gaps in what your life is like. Obviously, you spend a lot of time at work, but is there balance? I mean, you have a young family, and how does that all fit together?
Yes, so I'm glad you asked about my family, because I can't help it. So what makes it all worthwhile? Yes, it was actually sort of a wonderful thing to figure out that the career that I was passionate about also gave me the work-life balance that I wanted. It was like sort of the best of both worlds. For me, I come, it's generally for the most days 8 to 5:30 typically, which makes it great because I can have dinner and spend time with my husband and my son. As you can see them on the left here. On the right is him looking at a pathology journal and pointing out things. So I couldn't help but show a future budding pathologist there. But it makes it worthwhile because for me, I love my job, but it's also like when I'm home, and I get to spend time with my family and get to go on trips. And so the lifestyle is such that, when you're here, as Dr. Zhang said in a previous session, you're working, like, you're definitely wanting to be efficient and getting these things done. But for me, when I go home, it's it's family time. So I felt like there's a lot of balance to, like I said, I'm able to be home before dinner time, pick him up from daycare. I know that when he's in school, I'll have time to go to the recitals and the, band concerts or whatever he gets into. And that's really what also drew me to it. It's like, wow, it's something I love to do, but I also have time to have a family. And I actually did have, I had Jacob as my son during residency, and his first year of life was during fellowship. And so it was great that I had a lot of understanding people that I worked with who were very much about family and making sure that I spent time with him. And then just as far as my just lifestyle, I just want to point out, this is a snippet like from this week. A pathologist day in the life is, like I said, it's usually 8 to 5:30. Different institutions will split up services differently. And this is sort of our split up. I didn't put their names, but this is the four of us, the pathologists in HEME. We split up the service, and that's kind of what you do. But it's always punctuated by meetings, lectures you have to give, residents you're rotating with. And so you end up doing a lot during the day. But again, you get to go home and be with your family. That's my main passion right now. He's 2 years old, and so we get to just, see him grow and flourish, and going on trips with him, is a big deal to me. So that really makes it worthwhile. And then the other thing is, this is actually a picture of our resident group. They really make it worthwhile too, because you're training the next generation. You get to see their passion for pathology. As you can probably tell throughout the interview, I'm definitely passionate about teaching a lot. I love working with students and residents, showing them how cool pathology is, for one, and two, just helping them through that journey to maybe choosing pathology. But work-life balance is great, I will say. I think you've probably found that to be true also, Dr. Russell.
Well, yeah, I've been browsing through some old pictures, and I came across a photograph of myself lying on the floor reading a mycology text to my, 6-month-old son and so forth, right next to the one where, you read Goodnight Moon together. But all those sorts of experiences aside, you do have a complete life, and we're not unidimensional. And pathologists are not carrying around a microscope like a ball and chain. It's more like that's what gives you wings and gives you vision and allows you to see into the future for those patients that you're working with. But you also have that balance of the real people that are around you that you're working with, both at home as well as at work. And the educational component that you've mentioned, of course, is very, very fulfilling. As I know so many people who just, they want to do some teaching, they want to do this, do that, and there's so many teaching opportunities, not just with residents, but with technologists, with students, with even undergraduates that are, exploring careers or science and so forth, that even people who aren't in major institutions oftentimes have very significant teaching opportunities as part of this, career in pathology. So, so what's your advice for medical students that are, in the next couple of months going to be deciding where to interview and what to specialize in and so forth?
So I didn't put this on the slide, but the first thing is, as I said, whatever career you choose, if you're passionate about it, I say go for it is my first advice. Because all along the way, I have had people, again, who didn't really understand why I wanted to be a pathologist. And I have told people if I would have listened to them, my life would have been very different. So whatever you choose, it's go for it. Don't listen to those naysayers. If you're passionate about pathology, you're going, I love people who are passionate about what they do. And so you're going to be such an asset to wherever you end up. So definitely, have passion. Don't think you're choosing something wrong, whatever you choose. But the other thing, a couple of things that, I always advise students is, definitely join an interest group if you have one at your local institution, because you're going to meet some of the pathologists there, at your institution, and maybe get a chance to shadow them. Although there's not always a rotation available at every institution, I think it's always helpful and I say it because that's how I discovered Path. I don't think I necessarily would have otherwise. And rotate in as many areas as you can. I say that because pathology is actually a lot more broad than I thought. There's so many aspects to it that you can figure out. I mean, you maybe love blood and transfusion. You could love chemistry. I mean, there's just so much to it that's what I've noticed from some students. Even if they don't choose Path, they said, "Wow, I didn't know how much there was to choose from." So I always encourage people to make their way down there and see what Path is really like. And that way you get to know your local pathologists, because they're always, at least at our institution, we love having students shadow. We love having people come down and take tours. So that's always a good thing. I put social media because I couldn't not. Unfortunately, I'm not as active as Dr. Zhang is, but I say it because I always want to plug her as well as Dr. Gardner, because there's a lot of pathologists who are very active on social media that can, give you more information. And, I've seen actually medical students at pathology meetings. It really just kind of starts the ball rolling. And I think it's just, getting more of an idea of what we do. I tell people to do a rotation, even if they're not considering pathology, because I think it's just give you an idea of what we do every day and how we can help you, even if you go into surgery. So that's kind of my 2 cents, because I think I wouldn't have discovered Path otherwise. And that would have been a shame.
Yeah, it would, because you're such an asset. Well, I think you've made some very great points there. And you're right. Pathologists are much more social than many other specialties, not because we have time on our hands, but because we do have an educational role to provide. And medical students who do rotations in the laboratory, I think, become much more savvy practitioners, no matter the field, because they learn the potential, they learn how to use the laboratory appropriately, and they learn more about their consultative resources, which really can make you look a lot smarter as a clinician if you have a good pathologist backing you up and guiding you and helping you with your patients. So those are great things. Well, Chelsey, you're just a couple of years into your career. How do you know you're not going to burn out in pathology and want to change to something else? What are your thoughts about that?
That's a good question. I think definitely burnout is always definitely a consideration, and are you going to just say I've had it, I can't do it anymore? I've told people, at least at this point, I am only 2 years into my career. I'm not seasoned yet, but at the same time, I don't regret my decision at all. I feel there's a few things that are going to help with not having burnout. One, again, I have a work-life balance. I do my work, but I also know that when I go home, and I don't carry my work with me when I go home. It's about playing with my son. It's about going to the park. It's about, having that time to kind of mentally unpack everything. And now I will say sometimes you're kind of still thinking about the cases from the day. It can take you a couple minutes to kind of, wind down. But for me, when I'm home, and that really helps a lot with reducing burnout. The other thing is that, like I said, there's always something new every day. I feel I don't ever get bored with what I'm doing. There's always some new mystery to solve. And so I think that really helps to reduce a lack of engagement, with your job. And also being in an academic medical center, I love getting to interact with the students, because again, when you interact with people who are fresh into medical school and everything's new, everything's exciting, it kind of makes you excited too. I actually help out a lot with our gross anatomy course here, just because I enjoy it. But it's also a great chance these students have never seen a heart in real life before. They've never seen a brain before. And it's just really cool to watch their excitement. So it's like, how can you not be sort of excited by association? So I think it's about doing things that you're passionate about, and it's about having that balance to know that whenever you're away from work, you can truly be away from work. I think that's something that physicians struggle with. And I've really been intentional in trying to work about when I'm home, that's my focus. And when I'm here at work, it's my focus. So, you know, for me, I think those are things that have been shown to help with burnout. And, you know, like I said, and right now I think I'm like, nothing can dissuade me from pathology, but, you know, we'll see what the years show. But I think it's just, there was basically no other specialty that was meant for me, I think, at the end of the day.
Let's just say that we often see people coming from other specialties to work in pathology. We rarely see people leaving pathology to go into other specialties, but we often see people who diversify over the course of their career. True. Which is a wonderful thing about pathology, because you have such a breadth and there are so many niches within pathology that you really can have multiple kinds of careers over the course of your lifetime. And still have that same enthusiasm that you've talked about here. Well, Chelsey, thank you so much for spending this time with me. Do you have any final words you want to sort of summarize things with?
Well, I think just the summary, as you can tell, I'm definitely a talker, but the summary that I will say is that, you know, I'm really appreciative that you all are watching, and definitely reach out to us if you have any questions. We do love what we do. There's a reason why pathologists are
So what's going to keep you going for the next, 50 years, Chelsey?
I think, the final thing I would say is that I think, there's a reason why the pathologists are some of the happiest people in the hospital, is we just really enjoy what we do. I think that really keeps us going throughout the years. And we're happy to always answer questions about what we do, and just get people more interested. We love it. So any questions that we can answer, we're happy to. And I appreciate you all for listening.
Okay, thanks very much, Chelsey. And until next time, have a great day.
You too.